Alright guys, this is a how-to video, or what do I expect in a sterile kit video. Now I'm going to show you this particular thoracentesis kit, but each kit is going to be, specific to the procedure that is being carried out. But I want you to be aware of what you're going to actually see within a sterile kit. That might help you to know what to expect when you are having to assist with these sterile procedures, okay? Well, first of all, the kit's going to come like this, okay? And you would be expected to have some clean gloves on, okay, at this point. And the physician will be putting on a sterile garb, a gown, possibly you both would have to be wearing a mask, and maybe a hair bonnet, depending on policy and procedure of your facility, as well as what the procedure is that you're carrying out. So the physician is all garbed up and in their sterile clothes, okay? So you have the kit, and when you will be opening this kit, you will open it, like this, okay? Did you see that? You're going to open it this way, okay? And the physician will, at that point, because all of this stuff in here is sterile, okay, so you're not going to be touching it like I am. I'm touching it to show you. When you open it like this, the physician with their sterile glove will remove the contents, okay? All right? And either put this contents on a different area, another table, or remove, or you would remove, or they would remove the container that you just took that out of, okay? So now this is going to be their sterile field, okay? And I'm going to show you what to expect inside of a kit. Now again, remember, each kit is going to be pertaining to the procedure that you're carrying out, okay? But generally we'll have about the same kind of stuff in it, okay? Now the physician will be opening this, okay? You're just there as making sure that the patient is positioned correctly, is comfortable, is not, having any ill effects from the procedure going on, okay? All right. So then they always have a little card about Sharp's safety features, okay? In that the scalpels are a certain how to manually operate the scalpels, okay? They'll show them how to do this. In some of these kits, the scalpels are a one-time use, and the minute you push it up and then you're done, it'll there's a button that you push and it'll retract the sharps back into the holder, and you can't use it again. So some physicians forget that and will push the button thinking that they'll be able to reuse it, and they can't. So you may have to get another scalpel for them, okay? So this will tell you how to operate, or tell the physician how to operate the scalpel, okay? It's also talking about a Sharps Away 2 locking disposal cup, and what that is this, okay? It looks like this. And what happens is when the physician is done with his sharps, I got to go into this and get a sharps and show you. Oh, maybe. Okay, here's one. When they're done with their sharps, they would insert it into this cup, and it would be stuck in there, okay? That you can't remove it, all right? I'm not going to do that. Oops. You can't see that. Okay, you would stick it inside these little holes here, okay? And once it's stuck in there, you cannot remove it, okay? And that would be put right into the sharps container, okay? I'm not going to do that because I don't want to screw up this kit. That is the Sharps Away 2 locking disposal cup, okay? And that's located in the sterile kit, okay? All right. So there's that. Then they always have a suggested procedure using sterile technique in order to, you know, be able to use all of the items in here. They give directions, okay? All right. The next thing you're going to see is a sterile drape, okay? A sterile drape. And it looks like this. So this would go against the patient, and in this hole here will be the area that they're going to perform the procedure on, okay? And then this gets opened up, and you'll see it when I, you know, get it set up for the thoracentesis on the patient. See, it just looks like this, and it's draping the whole area around the procedure area, okay? Keeping it sterile. All right. The next would be some gauzes. They would have some gauzes in there, okay? For this particular procedure, because we're going to be draining off fluid in the thoracic area, you would need a drainage bag, okay? So that's what this is. Remember, each sterile kit will be dependent on the procedure that you're carrying out. So this one happens to be the thoracentesis. Okay, more information about the lidocaine that is within this sterile kit. Now, every sterile kit will have lidocaine, and I'll get to that in a moment. I'm sorry. You should have a chloroprep or some sort of prepping agent for the skin. Okay, once they put no. This will be done before they put the sterile drape on. To get the whole area clean, okay? So they'll be using a chloroprep on the skin. The lidocaine is used, and this is an ampule, okay? The physician will use to numb the procedural area. So it's used as an anesthetic there, okay? And, excuse me. Yeah, anesthetic. So they would use the gauze to open up the ampules, okay? All right? All right. The next is some collection tubes for here, okay? So there will be some collection tubes to send down to the lab for diagnostic workup. There is vacuum bottle tubing, and then a syringe pump system. Okay, so for this particular procedure, we would drain into a bag, okay? Or we would drain into a glass bottle the fluid that's coming off of the patient, depending on how much fluid we think is in there, okay? There is a 10 milliliter syringe. These are all typical stuff that you're going to find in kits, okay? 60 milliliter syringe in this kit. You may not find that in all sterile procedure kits, okay? This one actually has a stylet with the needle in order to, you know, puncture the chest, okay? Because we're going to be doing drawing off of fluid from the chest cavity. So this needle would be inserted in there, okay? So it's connected to a suction device, I mean a syringe, so that they can make sure that they're in the right area, okay? There is a stylet in there. Let me see if I can get that to come off. There is a needle here we go. So here, if you can see the needle in there, they would withdraw the needle once they got it into the cavity that they wanted it in, and so that would open up the tubing, okay? So that's what this is. All right? And then, hold on, trying to put it back in here. There we go. And then there's also another, this is for the sharps while they're working and they're not completely done with the sharps. They would take and stick their sharps into this material. You see how the sharps is stuck in there? And then that would allow them to be able to use it again, okay? It keeps the sharps all in a contained area. So this is basically what you would find in a sterile procedure kit. Okay, like I said, it's going to be dependent on the procedure that you're carrying out, okay? But generally it's going to be all of material like this, okay? All right, so that stops that video.